Good evening, everyone. Namaskar ji. So, dear friends, let's start 44 unit today. The 44 unit looks like little difficult, but it's most easiest part. 44 because 44 means the points available in the upper arm in this part. The number of points are very lesser, but the effectiveness is very high. Especially if someone is suffering with a high blood pressure. So most of the time we are using points here in the high blood pressure. Like someone is suffering with a high blood pressure plus back pain. Use the points here for back pain. High blood pressure plus liver disorders. Use the point here for the liver. High blood pressure plus reproductive problems. Use the point here. So if anyone is suffering with a high blood pressure with some problem, then we can use point here. They are very effective. And even someone is having high BP and just we want to treat the high BP, we are having very good points here because this arm is at the level of chest. So treating the heart and lungs, calming down the chest cavity and shed. So let's discuss the points. So look at the look at the arm. So if we look at the arm here, inside the arm, we are having one bone. The name of this bone is humerus bone. If we remove the muscles, then we will find the bone here. So this is the bone. And inside the upper arm, we are having only single bone. So this is the bone. The name of that bone is humerus. So this bone is called humerus bone. So many times we are inserting the points on the just anterior border of the humerus bone. Many times we are entering the point, inserting the point just on the posterior border of the humerus bone. So we will palpate the humerus bone here. Either we will put the points anterior or we'll go on the back side. We find the border and we'll put the point on the back side. And we know the muscle here in the anterior side, that is called biceps, and the muscle on the posterior side called triceps. So when we are doing exercises, we are telling this is our biceps, and the back side, this is our triceps. So anterior border of the humerus bone, this meridian is called large intestine meridian, and on the posterior side of the humerus bone, this meridian is called small intestine meridian. Sorry, this meridian is called triple warmer meridian. So bone is situated in between large intestine and triple warmer meridian. So let's see other image. Look at this image. So when we are putting the points where we are doing the insertion, so either we are putting on the anterior border of the humerus bone here, this is called large intestine meridian, or we are putting the point on the backside of humerus bone. This is called triple warmer meridian. Let's see in the other image. So we can see this image here. So what we are doing, we are palpating the bone, and on the anterior border of this bone, we are putting the points for the large intestine. In the same way, when we want to put the point for the triple bomber, we are going on the back side and putting the points on the back side. Let's see, 30. We are putting the points on the other side of the triple border meridian. So how we are searching the points? Again, I will tell you in this image. Generally, we are finding the humerus bone. Anterior side of the humerus bone, we are calculating this area as a large intestine. On the shoulder region, we know this is the large intestine 15. This is the large intestine 15. And just on the back border of this bone, this is the triple warmer meridian. On the back side of the shoulder, we are having triple warmer 14. So this is the muscle of the shoulder that is called deltoid muscle. Anterior side and posterior side covered by the Li 15 and triple warmer 14. So now we have understood the humerus bone. In the anterior side, it's occupied by the large intestine meridian, and in the posterior side, it is occupied by the triple warmer meridian. So before proceeding, I would like to tell you the location of one point. Now I will tell you the location of 44.01. The 44.01, which is the first point. So for knowing the location of 44.01, let's see this image. We can see the lung meridian in this image. At the location of elbow, this is the location of lung 5. Now, in the lung meridian only, if from this point we are going 1.5 chun up, that is the location of 44.01. Because this point is available very near to lung 5, and lung 5 is responsible for sending the kapha, sending the phlegm down, and lung 5 is also a very good point for kapha, very good point for phlegm, very good point for the rhinitis. So we are using this point for the same problem. So over this 44.01, which found in the lung meridian, which is 1.5 tune up from lung 5, this point useful for the common cold, for the rhinitis, for the laryngitis, and some throat infection, something like a throat infection. So generally what we are doing, as per the master Tung, the lung 5 is also called 33.12 as per the master Tung. So as per the master Tung, this also called 33.12. Am I right? 33, 13, 9, 10, 11, or 16, 13, 14, 15. As per the master, the lung 5 is called 33.16. And the lung 5 is very good for all the cough and cold. And especially lung 5 is the water point of lung. So sending the unwanted phlegm downward from the lungs. And the point which is 1.5 tune up, 44.01, that point also available in the lung, meridian only, and very much useful for multiple lung condition. So we can use lung 5 and 44.01 both together. So let's write down the indication here. So 44.01, 44.01, this point 1.5 tune up from lung 5 on lung meridian. This point is very much useful for common cold, throat infection, laryngitis, and anything happen in the throat cavity or rhinitis. So if anyone is suffering with the viral attack, with the bacterial attack, so the first symptoms will appear in the body. It may be rhinitis, laryngitis, and other. So these points, 44.0 point is very good point for that. Generally, we are combining lung 5 plus 44.01 and we are using both the point together for common cold. If we talk about the common cold only, so we are having very good common cold point. That is a 11.17. This point is in the index finger. These are the 2 points unit, 11.17. We are having leg common cold point. They are 88.07, 88.08, and they are in the thigh. And we already know, we already discussed. These points are available in the thigh, in the spleen meridian, at the level of upper two systems. So common cold 1 and common cold 2. So we are using these points. The third one, when we talk about the common cold, on the face region, these are the 2 points unit. 1.4 chun down, 1 obliquely, zero point 0.4 chun inner. So 0.4 chun down, then 0.4 chun inner, obliquely inner. These points are called 10, 10.19 and 20. Very good for common cold and lung disorder. If we talk about the other point, we are having leg rapid horses. 88.17, 18, 19. They are also very good for lungs. Then we are having finger rapid horses. 11.07. These points available on the index finger. These 3 point unit, that is called 11.07. These points also very good for lung disorder. So we are using them for common cold conditions. So there are many, many, many points in our human body. In this way, we can see there are multiple approach. And one of the point is 44.01. 44.01 is just 1.5 chin up from the lung 9 in the lung meridian. I have seen when 44.01 is most useful when someone is suffering with a stuff nose. And do not forget one very good important point for the cough and cold. That is stomach 43. the extreme point of stomach meridian. Because when we talk about the notch, look at the image. On the both side of the notch, this stomach meridian is passing. So we can do the stomach 2, stomach 3, stomach 4. Not only this, stomach and large intestine both belong to the yang ming. On the corner of nose, this is the yang ming or Li20. Not only this, we can see the Li19 just below the nostril. So in this way, Li19, Li20, and stomach, they are covering the area all around. So we can use the extreme point of the respective meridian, that is stomach 43. And stomach 43 is also very good for the stuffed nose. I have seen, if someone is complaining you that I am having right side block, right side nostril block, then you use 44.01 and stomach 43, 2 points. So what we are doing, let's see once again. Some patient is telling you that can you treat my block nose? Block nose on right side. So what we are doing? So this is the right side and this is the left side. LT means left, RT means right. So what we are doing? We are putting the 44.01 on the opposite side and the extreme point on the same side. This is the extreme point. So the extreme point is very much effective to open the notch. In this way, we can treat the problem arising. Either this is connected with the rhinitis, nasal discharge, common cold, laryngitis. We can treat these all conditions. Sometimes what we are doing, many patients suffering with a common cold since longer time. So this whole nose area always suffering. Then what we are doing? If this patient is suffering with the right sided nostrils suffering more, but maybe both side also suffering then also. So we can apply 44.01 here, 88.07 and 08. These two are lag common cold. We can apply stomach 43. This is a extreme point, very effective. So in this way, we can plan the treatment. So this is the option A. Option number B for common cold. We can apply 11.17 on the left side. 11.17 on the left side and common cold point in the leg, both sides. That is 88.07 and 8. And our 44.01 here. So in that way, we can plan multiple different types of protocol. One patient is suffering with a throat infection. Or laryngitis, or sore throat. So what we are doing here. So we are putting the third point, that is 77 point, 24 and 25. Even these points good for thyroid also, because thyroid also situated in the leg region. So we are taking these points 77.24 and 25 because these 2 points are very good for any condition for the throat. And these points we know available on the stomach meridian. Now we are also taking 44.01 and 11.17. In this way also, we are planning the different treatment. So sometimes we are taking the 77.24 and 25. These points good for thyroid and throat. So these points are good for sore throat. So we are having multiple options to apply. If we want to combine with the TCM, as per the TCM, lung 11 is a single point good for sore throat or throat infection. So we can also combine this. So right now my concern is this, that we should understand that 44.01 is a very good point for the throat, for the rhinitis, for the sinusitis, for laryngitis, for throat infection. So in this condition, we can use this point. Now look at my hand. So look at this hand. So this is the tendon in between the elbow. The name of this tendon is biceps tendon. I can even hold this tendon. I can feel the tendon here. So from this tendon, if I go one chin lateral, that is the location of lung 5. The lung 5 is very important point because when we are treating the lung 5, all the phlegm deposited in the lungs coming down toward the kidney. So lung 5 is responsible for descending action. Now from this lung 5, if I come 1.5 chin up, then this is the location of our 44.01. Even we can do the pressure here. So when someone is suffering with a cough and cold, I am telling them to do like this. Keep your thumb here and just do the Kapalabhati. 100 times. Morning, 100 times evening. So in this way, they are doing the acupressure for themselves. So it becomes the self-stimulation technique. And even this is required because nowadays we know there are many patients, they are away from us, but we want to help them. So we can suggest them this point. So this is called 44.01. Now let's proceed for the next point. That is 44.02345. These all the 4 points, even 6. These all points available on the triple Wormer meridian. So look at the arm. So this is the elbow joint. And we are having one bone here. The name of this bone is humerus bone. On the backside border, just on the border bone. This is the triple Wormer meridian. This is the triple Wormer meridian. Now, on the backside, we are having these all points in this line: 44.02, 44.03, 44.04, 44.05, and 44.06. Now, if we see 1, 2, 3, 4, 5 points are here. So this is the bone. This is the humerus bone. So first point, 44.01. Second point, 44.02. First point. Second point, 44.03. Third point, 44.04. Fourth point, 44.05. And the next point, 44.06. We will see the location, don't worry. Just right now, what I want to tell you, these all points on the posterior border of humerus bone. So let's see this image, other image. If we see from the backside, we are looking this human from the backside, then we can find this the triple Wormer meridian. The triple Wormer meridian, who is on the backside of this bone. So suppose this is the elbow joint, and this is the backside border of the triple Wormer bone, the backside border of the bone. Now, on the elbow junction, this is the point called triple Wormer, 10, and the shoulder junction, this is the point. The name is triple Wormer, 14. So we are having triple Wormer meridian, triple Wormer 10, to triple bottom 14 on the back side of this humerus bone. Now, what I told you that we are having 1, 2, 3, 4, and 5 point. That is 44 point. 02, 03, 04, 05, and 06. We are having total 6 point on the triple 5 point in the triple bottom meridian. So what I want to tell you here, listen very carefully. Very important thing I want to tell you. Just forget the point for a while. Just forget the point. Just remember that this is the elbow region, this is the shoulder region, and this is the complete arm. And this is the border of the back side of this bone. And we are knowing this with the name of triple bulbar. Now, if we divide this in 3 equal parts, 1, 1, and 1. So this is the upper part, this is the middle part, this is the lower part. So we have divided upper part in the middle part and in the lower part. So the upper part working for the heart, middle part working for the heart and liver, and the lower part working for the kidney. So in this way, if you put the needle randomly just on the back border of this bone, if someone is having some problem, you put the needle in the upper part for upper body, in the middle part for middle body, in the lower part for lower body like kidney. So this is following this concept of our small Tai Chi. As per the concept of small Tai Chi, every bone represents complete human body. Now this humerus bone also represents the complete human body. Now you will ask me, okay, what is the difference? What is the difference? Why we should use the liver point here? Why we should use the kidney point here? Because we are having kidney points, liver point, heart point in many other part also. So I will tell you, if someone is having kidney problem with high blood pressure, so better to use this area. If someone is suffering with a liver problem or heart problem with the high blood pressure, better to use this area. If someone is suffering with the problem in the heart or in the upper part of the body with high blood pressure, better to use this area rather than other area, because this arm is coming at the level of chest cavity, so very excellent for cardiac condition and hypertension. Why I'm telling this? Because some patient coming to you with a hypertension and now another patient coming to you with a hypertension, both patient may not be same. One patient suffering with a high blood pressure because of the kidney problem, another patient suffering with a high blood pressure because of the anger or liver problem, third patient suffering with a high blood pressure because of the cardiac condition. So the high blood pressure is not same for everyone. It may vary, the root cause may vary person to person. So in this way, one patient telling you, doctor, I'm feeling some chest heaviness, dizziness, and high blood pressure. Better to use this upper area. But another patient is having high anger, fatty liver, and high blood pressure. Better to use this middle area. One patient suffering with the nephritis, kidney problem, chronic kidney disease. So better to use this lower area. So in this way, these points are very much effective for these all conditions. And the results are really very wonderful. We can treat the high blood pressure very successfully. So let's see the points one by one. So if we start from the lower part, which is kidney area. So I am drawing the line at the back side of the triple bomber. Okay, this is the elbow joint. So first we are going 2.5 tune up, then 2 tune up. So 2.5 tune up and 2 tune up. These are the 2 points of the lower body. So this is called 44.02 and this is called 44.03, 44.02 and 44.03 coming in the lower part of humerus bone. So representing the lower body, so they are doing the representation of kidney. So we are using these points for nephritis or kidney failure. Nephritis and kidney failure. Not only this, because of the kidney, if there is any problem happening, because as per the acupuncture, kidney also connected with our vertebra. So these points also very effective if anything happen in the vertebra. So we are also telling the other name of these points are WAC vertebra point. The other name of these points are. So these are the lower parts. So let's write down. So this is the arm. So this is the elbow joint. First point will be 2.5 tune up from elbow. The second point will be 2 tune up from elbow. These points are called 44.02 and 44.03. So 44.02 and 44.03 are these points are in the lower part of humerus bone. Okay, so representing lower body. So they are represented in kidney. And kidney is connected with the kidney organ. And kidney also connected with our bones or vertebra. So these points are very much useful. Number one, these points are very much useful for nephritis or kidney disease. Second, these points are very much useful for the vertebra, for bones, for lower back pain, because these points are very good for the lower body. So any problem which is connected with the vertebrae, so these points are very useful for the spinal pain. So we are using this point for spinal pain. And all the points, either this is a 44.02, 44.03, 4, 5, 6. These points are on the level of chest cavity. So these all points are good for high blood pressure. So good for kidney, good for vertebra and high BP. So one patient coming to me, doctor, I have three problems. Number one, I'm hypertensive. Number two, I'm having little more creatinine level in my blood. Number three, lower back pain. So the perfect patient, because we are having the three indication. Number one, these points good for high blood pressure because coming on the level of heart or chest. These points very good for the spinal pain and vertebra, and these points are very good for kidney problem, nephritis. In this way, these 2 point unit, one is 44.02, another is 44.03. These 2 point unit are very much useful for these conditions. Hope you understood. A person suffering with a low BP, then we cannot use these points. So better to go in other body area because we are having multiple areas in the body. So in this way, 44.02, 2.5 tune up and 3 to tune up. Let's see this image. In this image, we can see this olecranon process. This is the elbow joint and this is olecranon process. Now, just at the location of olecranon process, we are having triple Borman 10 because triple Borman meridian is crossing the olecranon process and going following this pathway. So from the elbow joint, first point will be 2.5 tune up, 2.5 tune proximal. Then second point will be 2 tune up, then 2 tune proximal. So the first point will be 2.5 tune up, second point will be 2 tune proximal. These 2 point unit are called 44.02 and 44.03. Very good point for vertebra, kidney, and the mainly vertebra and kidney. Because these points coming in the lower part of this humerus bone. You know, Master Tung family was using just this logic. Suppose Master Tung family was using this logic only. Because first they see, okay, this area is coming on the chest level. So definitely it should be good for heart. So it should be good for high BP. Now, second, they are using the microsystem. As per the microsystem, every bone can be divided in whole body. Multiple, every bone is representing the whole body. So if we go in the lower part of this bone, definitely it will represent the kidney. So if someone is suffering with a kidney problem as well as the high blood pressure, so this is the better approach than other area. So with this concept, even we can think because this is just a microsystem like a sujog in the where we are doing the imagination of whole body in one index finger, that is inside correspondence system. So in the same way, we are doing the imagination of whole body just in the humerus bone. Sometimes we are doing normal imagination and sometimes we are doing reverse imagination in that way. So these are 2 points, 44.02 and 44.03. So like this is the olical process. We have to count from here only. Because we are counting from the elbow. From here only. Then we are going, this is the tuchul. Then little more, 2.5. So this is the first point. Sorry. We have to go upward. So this is the oligurine process. This is the tuchul. With the help of 3 finger, we can measure tuchul. So we have reached here. And this is the half. So this is the first point. So we can put the needle here. We have to measure from here. This is the oligurine process. Just measure from here. You can keep all the 4 finger. Then put the point below the small finger. Because that is 2.5 chin. Because a small finger itself, a small finger, the tip of a small finger is half chin. So we can keep all the 4 finger and under the small finger, we can put the point. Just on the back border of this humerus bone. This is the point. This is a very good point for the kidney. Nephritis, hypertension because of kidney. Understood? Got it? Now, if we keep our 4 finger, if we want to press here also, we can do the gentle acupressure here. We can do the gentle acupressure. Because we have to put the point on the border bone. So we can feel the border bone here. Either you measure from here, or you measure from here, or you measure from here. Just go 2.5 chin. Then ultimately you have to put the point on the border bone. Just on the border bone. That is so first point we will put on the 2.5 chin up. Then again 2 chin up because we have to put 2 points together. Then we'll achieve the very good results. So what we are doing, we are keeping 4 finger here. So first point below the small finger. So this is the first point. Then again we are measuring 2 chin. This is the second point. So these are the 2 points. Point number 1, 2.5 chin up. Point number 2 is 2 chin up. These are 2 point unit, which is very good for the lower back pain as well as the kidney problem. It may be painful, definitely, because everyone is having. kidney deficiency, so it may be painful. Now, if from here we are going 2.5 chun, then 2 chun, then 2.5 chun, and 1 chun. So 4 point, 2.5 to 2.51. Repeating again. From the Orlecan process, 2.5, 2, 2.5, 1. So these are the point 2, 3, 4, 5. 2, 3 for kidney, 4, 5 for middle part like a liver, and upper point for heart. We'll discuss later on. Upper point we'll discuss later on. So 2.5, 2, 2.5, 1. This is the chun measurement, just on the same line. So look at this image. From the elbow region, 2.5 chun out. Then 2 chun out. Again 2.5 chun out. Then just 1 chun up. So 2.5 chun, 2 chun, 2.5 chun, 1 chun. That is 44.02, 44.03. Good for kidney and lower back pain. 44.04, 44.05. Good for middle part like a liver as well as heart. And third point, last point, 44.06 will discuss later on, because the 44.06 having lots of indication. So if we want to treat the liver, so this is the triple bow meridian, this is the lower part, this is the upper part. Then we are treating the middle part because this is connected to the liver as well as heart. And here we are having 44.0, 4 and 0.5. So let's write down here. On the triple bow meridian, from elbow, we are going 2.5 chun up or 2.5 chun proximal. Then 2 chun proximal, then 2.5 chun proximal, then 2 chun proximal. So 2.5 chun, that is 44.02, then 44.03. Both together called kidney point. Then 44.04, 44.05. These points good for liver and heart. So let's see once again. Suppose this is the elbow region. This is the elbow. And this is the bone. Humerus. So from the elbow region, we are going 2.5 chin up. That is the first point. Then 2 chin up. That is the second point. Then 2.5 chin up. That is the third point. Then 1 chin up. That is the fourth point. So these points called 44.02, 44.03, 44.04, 44.05. Now, if we talk about the middle point, the 44.04 and 44.05, they are the very good for liver and heart. Because as per the five element, when liver fires plus plus plus, maybe because of anger, maybe because of the nature, maybe because of something other like alcohol, or there is some disturbances in the heart, these both together can generate high BP. So the 44.04, 44.05, bilateral, they are the very good point for high blood pressure. If we use them both the side, bilateral. So 44.04, the upper 2 points are very good for the high blood pressure. So we are using them 44.04 or 44.05. So 44.04 is very good for high BP, very good for liver and heart, very good for if there is anything happening. Sometimes patient is telling doctor, I am having dizziness. And when we check the BP is higher. So 44.04 and 44.05 are one of the best choice for high BP. I am usually putting these points bilateral for my patient if they are suffering with high BP, and I am getting good results. And 44.05 also very good for high BP and liver and heart. Very good point if there is a coronary heart disease. So I would like to tell you, like this is the arm, okay? So first 2 points are good for kidney. That is 44.02 and 44.03. The third point good for liver as well as heart. And the fourth point, 44.05, is mainly good for heart. Mainly good for heart. Even it is good for heart and beat, but just as per the imagination only. Because heart is in the upper part of the body, liver in the middle part of the body, and kidney in the lower part of the body. So when we are using 44.05, 44.04, we are treating the liver heart and we are also treating the heart. So suppose someone is telling you, doctor, I am having high blood pressure and some cardiac problem like coronary artery disease. So just you can use upper point only. That is also enough. You can tell, okay, when the person is suffering just with a cardiac problem, then why should I use kidney point? Why should I use liver point? I will use just one point, that is heart point. Okay, no problem, use it. Sometime we are doing the combined approach. I am using 44.04 and 5 for high blood pressure and getting very good results. Bilateral. So in this way, if we talk about the 44.04, it is mainly good for liver and heart. So it is because of this is very good for high BP, because all the points good for high BP we already know. And many times person is getting dizzy because of high BP. Now other point 44.05, it is even good, but mainly it is good for heart because it is upper point. Still we have one more point left, 44.06, which we'll discuss tomorrow. That is also good for heart. If you want to ask right now, tell me all the points. So I will make three groups. In the 2 points in the lower group, 2 points in the other group, upper group, 1 point in the middle group. In the lower group, I will keep 44.02 and 44.03. In the middle group, I will keep 44.04. In the upper group, I will keep 44.05 and 44.06. The main indication of these point heart. The main indication of these point liver plus heart. The main indication of these point is kidney. So if anyone is suffering with these problems with high blood pressure and dizziness, with high blood pressure and dizziness, use these points. Kidney problem with high blood pressure, use these points. Liver problem with high blood pressure, yes, in this way. If you just want to treat the high BP, the immediate instant approach, number one, 44.04, 44.05, 77.17, 77.18, bilateral, and number two, blood late, ear apex. You will see the changes in the blood pressure immediately. Because the ear apex is the point of liver yang. Okay. So in this way, we can treat the high blood pressure immediately. So this is a very good protocol for the high BP. Now suppose someone is suffering with a kidney problem, and with that he is also having high blood pressure. Then what to do? Then we can use, because kidney also responsible for the high blood pressure. So we can choose 44.02, 44.03. Now these points good for high kidney as well as high BP, as well as 77.17, 77.18, and bleed ear apex. But if you are confused, you don't know what is the real problem, then go for this protocol. This is universal protocol. But nowadays, one patient coming to me, he is having kidney problem, kidney disease. So suddenly he came on, he is feeling very good. I'm working for the serum creatinine because serum creatinine and blood urea is very high. And this is very new patients. So we will do the reports after a few sittings. The serum creatinine is near about 6, something 5.9. Serum creatinine 5.9, yes. This patient is very thin, very thin. thin, very intellectual, and all the symptoms of yin deficiency. What are the symptoms of yin deficiency? Like dry throat, feverish feeling, night, thirst. These are the symptoms of yin deficiency. And we discuss these things in the TCM, we know that. The sign of yin deficiency: dry throat, feverish feeling, night thirst, night sweating, and person is thin. Okay, so as per the TCM, the most important point to improve the yin are CV4, LU7, kidney 6, and heart 6. These are the points as per the TCM. So I am giving these points, but with that, I'm also using some other points. I'm also adding kidney 3, kidney 9. I'm also adding some other point as well, like mastering point, lower 3 emperor. And with that, this 44 point, 04, 05, and 77.1718. Symptomatically, he's feeling much better. We'll see in the report. Because just we have started the treatment, now he's feeling much better, even in the blood pressure. Because if there is a yin deficiency, that also will create the high blood pressure. Because the meaning of yin deficiency, the yang is comparatively high and it will create hot feeling. The another patient is coming to me, the female lady, who is having hot flushes. Something like hot. What is hot? So improve cooling. How to improve cooling? So improve yin. So in the master tongue acupuncture, best point to improve the yin is lower 3 emperor. Lower 3 emperor, 77.17. But I am using 18 because this is the kidney point, kidney gate, 19 and 21. So I want to reduce the hot flushes. So I am using 77.18, 1921 plus these 4 points, which I told you to improve the yin. CV4, LU7, heart 6 and kidney 6 to improve yin. Because I want to improve the cooling, to improve cooling. One another patient coming to me. The patient is very spiritual type of person. He is doing lots of mantra chanting throughout the, and how lots of siddhi and whatever, even I don't know. Because when he is coming, he is speaking, I am listening. I listen, he speak 10 words, then I speak 1 word. So he is so full and doing lots of mantra chanting and all. So heat is very higher. Heat is too high. So in the spiritual person, there are 2 conditions. Number 1 condition, it is sure they are having heat plus plus plus. So because they are having lots of heat, so either they are suffering with the yin deficiency. Yin deficiency means high heat. So I am treating this person as a yin deficiency only. So CV4, LU7, heart 6, kidney 6 to improve yin, as well as lower 3 emperor. Okay. Now, sometimes spiritual person having liver heat plus plus. Liver heat is very high, anger is very high. So what I am doing with this patient, I am also doing blood late on ear apex, because if there is a, it is very good for reducing the heat. So in this way, we can improve the cooling, we can improve the yin. So I was talking about this kidney patient where I am using 44.04, 44.05, 77.17, 77.18. He is much happier. He is much better. Okay. So enough for today. If some patient suffering with a high BP as well as a low BP, so better to forget the BP. Just treat the body organ like you can treat the heart. So we can use our heart point in the legs. We know the heart point in the legs, that is 88.0123. Do the bilateral needling, improve the capacity of the heart, because sometimes high, sometimes low. So we can't put the points either for reducing or for increasing the BP. Okay. Okay, so now it is 5 o'clock. We are closing the meeting. We'll meet you after 5 minutes. Thank you so much.